It's been a decade since Hollywood star Michael Douglas said that his throat cancer was caused by the human papillomavirus, which was transmitted through oral sex. The association between sex and cancers came as a shocker back then. Today, this sexually transmitted virus is associated with more than 3 lakh cervical cancer deaths each year. Now, there is a vaccine which has nearly 100% efficacy against this virus. Why are we seeing these alarming numbers then? Hello and welcome, you're watching Happiest Health. In this episode of the Y-Axis, we look at why India is on a mission to vaccinate its teenagers against HPV. We asked people around if they are aware of sexually transmitted infections. Here's what they said.
Do you know any of the STIs?
Chlamydia, one of them.
There's chlamydia, there's AIDS, of course.
I'm sorry, I don't.
Gonorrhea?
There's syphilis, I think. There's very few, again, AIDS.
Never come across, I don't know.
HIV is like the most common infection, I guess. And apart from that, syphilis, gonorrhea and stuff like that.
Syphilis, gonorrhea,
Okay.
then chlamydia.
Everybody knows it's AIDS.
Okay.
More than 1 million sexually transmitted infections are acquired every day worldwide. While HIV, syphilis, and chlamydia are all serious conditions, HPV is the most common STI worldwide.
The problem is that we don't screen everybody for it. So it's really difficult to get a number. But it is said that, and research shows that almost every woman will have HPV virus infection at some point of time in her life. Well, unfortunately, human papillomavirus doesn't show up any symptoms, unlike any other infections, vaginal infections, which can show up as discharge or itching or burning. This is in terms of the HPV at the cervix, whereas HPV-related warts obviously will show up as warts.
About 8 in 10 people will be infected by one or more types of HPV at some point of time in their lives. At least 300 million women have an HPV infection, the primary cause of cervical cancer. There are more than 100 known HPV types. HPV type 16 and 18 cause cervical cancer, while other high-risk type cause various other complications.
Mainly genitourinary related, like cervical cancer, vulval cancer, vaginal cancer. These are in the females, and in common anal canal cancer, or for male penile cancer and penile warts, and for both sexes it is oropharyngeal cancer or oral cavity cancers and laryngeal cancers. These are the most important cancers which are related. Apart from this, warts, genital warts and pre-invasive cancers conditions can be related to this.
Vaccine against this virus has been in use since 2006 in the US, and since then HPV-related cancers and warts have reduced by 88% among teen girls. In India, the vaccine has been licensed for use since 2008, but only 1% of girls are vaccinated.
Most parents accept it as the norm once it's less than 5 years. Now, above 5 years, as the child is growing, being fairly well, people tend to forget about vaccines. 10th year and above, we have 2 important vaccines. One is the booster dose of the diphtheria, pertussis and tetanus, which is again very important. And next, especially in girls, it is the recommendation to take the cervical cancer vaccine. Right now, we all know the reality. Young adults, adolescents are exposed to sex, and there is a chance that they may come across sexual exposure. So initiating this conversation with parents is quite healthy, and believe it or not, the cancer can happen 15 to 20 years later.
Cervical cancer cases in India are projected to increase by 26% in the next 7 years, and cervical cancer deaths by 29%. But less than 2% women in India are presently screened for cervical cancer. India's incidence and mortality rates are also higher than the global average.
The only way we can pick it up is through HPV testing, and that too, it's not a blood test, it's actually a test done from the neck of the womb. So we take a brush and look for the actual HPV virus. HPV is not a secretion virus in the sense it just doesn't come out through the semen. So it has nothing to do with just the semen. It's also through contact, skin to skin, the genital skin contact, right? And even if one uses a condom, the whole entire private part is not covered by it. So there is always the chance of the risk of the virus sort of transferring from one to another.
The virus can enter the body through small abrasions on the skin surface, mostly through sexual contact. Once inside the body, HPV infects basal cells of epithelium. The virus takes over host cells and replicates its genetic material, which could eventually lead to cancer if not detected on time.
The most important thing which it presents is bleeding. Bleeding can happen between 2 periods, or it may happen excessively during a period, or post-coital, after a sex it happens. So these are the things which are most common to present with, and sometimes there will be foul smelling discharge or some discomfort in the pelvis or lower abdomen. These are the things which will be most often seen in a woman having a cervical cancer.
The human papillomavirus need not always lead to cancer, but does HPV always lead to some kind of infection? What other risk factors are at play?
If one has a good immunity against fighting any infection for that matter, many a times our immunity clears it up. There are some situations where the HPV gets an upper hand. So if a woman is a smoker for that matter, or has multiple, sexual partners, is promiscuous, or her general immunity is not good, or her hygiene is not good, these are the situations where the HPV has an upper hand, and it can cause those cellular changes, which eventually can cause cervical cancer.
Since the virus is sexually transmitted, it is recommended that the vaccine be taken in the reproductive age. But what age is ideal?
We would like to vaccinate children at the age before sexual exposure. So the earlier the better, less than 15 years, that is between the 9th year and 14 years. The Indian Academy of Pediatrics advises a 2-dose schedule. If we give the first dose today, we give the next dose after 6 months. The minimum duration between the two is 5 completed months. On the other hand, after the 14th birthday, from the 15th year onwards till about 26 years, the recommendation is to give 3 doses at 0 and further at 2 months and later at 6 months. So in the market, we have 2 available vaccines. One which has 4 serotypes, which is called as the quadrivalent vaccine. The second is a nanovalent vaccine, which has 9 serotypes, offering much higher protection even against the rare forms of the virus.
Even though we say that 9 to 45 years is the right age to give it, it doesn't say it's a very hard and fast rule that you have to sort of cut it off at 45. So if a woman comes at 46 or 47 and says, look, this is had been my history, can I still take the vaccination? I wouldn't say no to her, right? But as you rightly pointed out, before the sexual debut, if they have it, the protection is the highest. It's almost up to 90%. Even if there is a HPV infection, the most important thing to understand is the HPV actually causes changes in the cells. So even though the HPV is causing the changes in the cells, taking the shot will still help improve the immunogenicity, improve the body's ability to fight it, and also give protection to the other subtypes which may cause trouble. So, which is why vaccination can be taken at any point of time, of course, unless she's pregnant.
Cervical cancer is the cancer of the cervix. So should only women and girls take this vaccine?
Cervical cancer is the cancer of women, but it is transmitted sexually. So it requires transmission from a male partner to a female and vice versa. So yes, boys are also affected. It is recommended that they take the vaccine as well internationally. In the Indian recommendation, there is a particular type of the vaccine which can be given to boys, which requires a one-on-one conversation.
The World Health Organization has given a 90-70-90 target to eliminate cervical cancer globally. This means vaccinate at least 90% of girls by age 15, screen at least 70% of women by age 35, and offer treatment to at least 90% of women diagnosed. According to the Global Health Body, if cervical cancer is eliminated, 250,000 women will remain in the workforce. contributing to $28 billion to the global economy. Now that is the larger picture.
If infection can be prevented, then major 90% of the cervical cancers can be prevented. None of the cancers we have a vaccine like this, and none of the cancers we know the exact reason. We know the reason and we have a vaccine here. We should be able to eradicate or nearly come to a position where cervical cancer should be eliminated from the society because of this vaccine itself.
In January this year, the Indian Ministry of Health and Family Welfare began a national program to vaccinate 68 million girls aged 9 to 14 years by the end of 2025. Following this, 11.2 million girls aged 9 years will subsequently be targeted for routine HPV vaccination each year. While this happens, are there side effects to taking the HPV vaccine that you should be aware of?
The only possible side effects are, like with most other vaccines, causing local side effects, which is possibly some redness, swelling, etc.
It doesn't affect the hormones, it doesn't affect the endocrinological, sort of milieu, let's say. It doesn't affect the periods, nor does it affect immunity towards anything else.
Long story short, HPV vaccine is one of the most effective primary preventive measures against cervical cancer. Reach out to your medical practitioner to understand when and how your child can get vaccinated.